Hello listeners, welcome to Views on Health. On the program tonight is Dr. Nilangika Sandakumari, consultant physician, University of Sri Jayawardhanapura. Thank you very much for coming back to SLBC and our studios, Doctor, after a short spell. Pleasure to have you. And an area that Dr. Nilangika Sandakumari specializes in is pharmacology. So based on that specialty, the topic under discussion tonight is antibiotic resistance. Again, from our lay perspective, antibiotics treat you and help you to overcome many ailments. It's all bacterial infections are prescribed with various antibiotics. And then what is more important is the fact that people find it a quick fix, so to speak. And we people from the general public are guilty of just going over to a pharmacy, and if you know the pharmacist well enough, you're quite likely to get what you want. Though in the last few years, I must say, this trend has been curtailed to a great extent thanks to the awareness created by the Ministry of Health on pharmacies being actually instructed not to sell prescription drugs over the counter. So a prescription is necessary if you need to buy your antibiotics, and that's how it should be. So having said that, Doctor, welcome back again. And the microphone is yours to enlighten our listeners on antibiotic resistance.
Yes, thank you very much for the introduction and all that. So first of all, we'll have a look at what antibiotics are. Now, before early 1920s, we didn't have antibiotics. So most of the deaths due to communicable diseases were, we didn't have anything to fight against them. In 1928, Alexander Fleming discovered penicillin. So that is the point where there was a major drastic change in medical practice, and now we were ready to fight against infectious diseases, and everybody thought now we can overcome infections. Before that era, actually infections were one of the leading causes of deaths worldwide. With the discovery of penicillin, we could fight with lot of bacteria. Now antibiotics are meant to kill or destroy bacteria. Communicable diseases are caused by various types of organisms, bacteria, viruses, and certain fungi also. So, a lot of causative organisms are there. Bacteria is only one cause. These antibacterials are meant for bacteria, not for the others, not for the viruses and not for the fungi. So then, after the discovery of this penicillin and the antibiotics, everybody was happy, thinking that it will end the burden of bacterial diseases. But sooner, what happened was, in few years' time, the bacteria didn't stay quietly. They also started fighting against for the antibiotic. So bacteria fought against antibiotics, and then they developed their own ways and mechanisms to prevent being killed by this antibiotic. So after the discovery of penicillin, lot of other antibiotics came. Some antibiotics go and kill the bacteria by destroying its cell wall. Some will kill the bacteria by preventing it from generating its proteins. So some will go and destroy its nuclear material, or what we call DNA and all that. So lot of points were targets, and scientists developed various types of antibiotics. But this microbe or the bacteria was also fighting against, And they also found several mechanisms or several ways to combat against. Some, what they do is, they will alter their target site. If you target bacterial DNA as the target, they will change it. Like that, they also developed certain ways to fight against. And then, for the infection that you gave the antibiotic before, now if you give the same antibiotic, it is not going to work because the bacteria is no more susceptible to that antibiotic. Then we call it that the bacteria is resistant to antibiotic. This resistance is not something that the person develops. The resistance is in bacteria. Bacteria is resistant. Now what happens is, this bacteria, when it goes and infect another person, however much antibiotic that you give, it is not going to kill that organism. So antibiotic resistance is again a community problem, global problem. If that resistance is generated at one place, the resistant organism will go and spread it into several people, and then it will be a global problem. So you will not have another drug to treat. Then you will have to find or discover another drug. Like that, it's a big problem. So what are the causes of this bacterial resistance? First thing I would say, the irrational use of antibiotics. Now, at the beginning, I told that antibiotics are meant for bacterial infections, but most of the time we get viral infections. Common cold is a viral infection. Most of the diarrheas, watery diarrheas, are viral infections. But I have seen some people are taking antibiotics even for common cold. And for diarrhea, even if it is a viral diarrhea, it is watery diarrhea, a lot of people tend to take antibiotics. So that is unnecessary overusage or misuse of antibiotics. There's no bacteria causing the disease, but you're taking it, and then you are exposing the other bacteria and the bacteria in the environment for the antibiotic, and they will develop resistance, and they will later on cause problems. So don't take, it is important not to take antibiotics for viral infections. If it is a common cold, watery diarrhea, don't take antibiotics. If there is any evidence of secondary bacterial infection with the common cold, then it is okay to go ahead with the antibiotic. But for a simple common cold or simple viral respiratory infection, getting an antibiotic is doing more harm than good. And then the other thing is, if you take less than the recommended dose of the drug, that also can predispose to resistance. Now we call it subtherapeutic dose. Less than the recommended dose, then that is also a problem. Now I have seen some patients, when they develop a chest infection, they take the drug that was given few months ago for a similar kind of infection without going to a doctor or without taking any medical advice. They will take the antibiotic either over the counter or from what is left over. They will use the same antibiotic for the second similar infection without even checking whether it is a bacterial one or not. So such practices can increase the development of resistance. So it is not advisable to use the leftover medications or somebody else's medication. If your friend is treated for a chest infection with a certain type of antibiotic like erythromycin, if you take that also because you are also having a chest infection, if you take it by yourself without any medical advice, you are abusing antibiotics. So that is also not advisable. If it is not indicated for you, don't take it. Don't take the leftovers also. Try to minimize antibiotic usage. Keep it for where it is really necessary. And then the other important thing is, you need to minimize the infections. Then you will not it will not be necessary to use these antibiotics frequently. How can you minimize the infections? First thing is important, now these days we talk about them. Hand hygiene. Hand hygiene is not only for COVID infection, it is for even for bacterial infections. Keep hand hygiene is very important before preparing food, and then before touching another patient by a doctor. So very important to clean your hands properly. So hand hygiene, and then food hygiene, that is also important. And like that, you need to minimize the chance of acquiring a bacterial infection. Then you will not have to use these unnecessarily. And doctors also have a significant role to play here. When we are prescribing antibiotics, we have to double check whether this is really needed, whether this is a viral infection, whether this patient, does he really need an antibiotic for this one? Do we have to wait a little and see whether the patient develops evidence of any secondary bacterial infection before going into a antibiotic? And when we are prescribing also, doctors, it's better if we can prescribe the narrow spectrum antibiotics which will cover the condition, rather than going into a broad spectrum, more potent ones to cover a simple infection. Now, if you treat a simple infection like a simple chest infection with a very broad spectrum antibiotic, that will minimize the chance of you to use that broad spectrum antibiotic to treat a higher degree of infection, like we call sepsis and all that, where you will have a lot of organs involved and patient is seriously ill. You need to use a antibiotic with more potency, with a more spectrum of coverage. But now you have given the patient it for a simple infection, and when the patient is having more resistant organisms, you can't use that broad spectrum one, because already the organisms have developed resistance. So where in whatever situations, when it is possible, try to use the narrowest spectrum antibiotic. If it is not really indicated, don't use it. If it is a viral infection, don't use it. If it is indicated, use the narrowest spectrum one, and then keep and reserve the broad spectrum ones for serious infections. So what we have seen is, on the very first visit, maybe because patients also want a very quick dramatic relief, they don't think about the future long-term effects of this abusive type of abusive type of behavior. They don't consider the long-term effects. They just concentrate on the acute situation. They want a quick relief and they go for the broad spectrum antibiotic and take it. Sometimes, even if it is prohibited, as you said, not to issue them without a prescription, if they take it over the counter, then that is a big problem. Over the counter broad spectrum antibiotics will cause more harm than the good. So that is very important fact for us to remember. And there is another area where antibiotics are used, that is in farming industry. In the earlier days it was not much popular, but now farm animals are given antibiotics, that is to increase the as prophylaxis. Prophylaxis is the animal is not having any disease, but they are giving it just to get a more productivity and all that. They give antibiotics for farm animals. Now, most of the time antibiotics are given in suboptimal doses for animals. Then that will again contribute to the development of resistance. And these animals will retain the antibiotics in their body. When you cook and eat, those antibiotics can go into your body, human body, and it can mix up with water, with soil and all that, and then bacteria will grow the resistance. So a lot of problems are there. Abusive type of behavior can cause problems.
Doctor, just a question, very interesting that you brought farm animals in. This is for the first time we are hearing this. And so if farm animals are fed for whatever reason, to boost productivity or whatever reason, or to prevent the animals from catching some sort of disease where they lose the animal, so they rather protect it from their perspective because it's profit oriented.
Yes.
To have the animal,
Right.
that they can get the maximum out of that animal. And then you said that when we eat, say take if it's like chicken, goats, cows, and the flesh which is consumed, and you say that if these antibiotics are in the system of those animals, that it automatically comes into our system. My question here is, in the cooking process, don't they get destroyed?
Now,
just a question I want to know.
Now it is not only the antibiotic, but the organisms which have become resistant to antibiotic are there in their meat or flesh. So if it is not properly cooked, or if it is half boiled, or not in the optimal condition where all the organisms are destroyed, those resistant organisms can get into humans also, and they can also go into the environment. So resistant organisms can spread. Even the antibiotics in certain concentrations can go into the environment when the animal dies, or when the animal is consumed, can go into the humans and can get collected in the environment. So giving animals or feeding animals with antibiotics to increase the productivity is, although it is not much of a very big problem in our country, worldwide it's a big problem. You must give antibiotics to an animal only with the after discussing or recommendation, after getting the recommendation from a veterinarian doctor, so that the needed antibiotic is only given. It is not blindly given. Now in the past days, certain medical conditions, we gave prophylactic antibiotics, that is antibiotics to prevent a person getting an infection if he has a medical condition. For example, there is a medical condition called infective endocarditis, which is bacteria growing in the heart. So certain people in the previous days, people who are undergoing certain procedures like camera tests to look into their bowels or their bladder and all that, received prophylactic antibiotics to prevent getting infection and developing infective endocarditis. But now the current guidelines do not recommend giving prophylactic antibiotics, because giving prophylactic antibiotics in such conditions can predispose to more resistance development rather than doing good. So the benefit is less. So now for routine procedures like putting a camera, putting an endoscopy, these things you don't give antibiotics before doing the procedure to prevent the development of endocarditis. Why are they limited? Because the problem of abusing or overusing antibiotics. Now what will happen is, if you go at this rate, in this way, now it is not only limited to Sri Lanka but worldwide, this way in about 2050, again we will go back to a similar situation like pre-antibiotic era. Because now the organisms have developed resistance to all the antibiotics discovered so far, and we have used it abundantly, and now the bacteria are virulent and they have all the mechanisms to fight against, and then like you're not having any antibiotic to treat. So it is not only the responsibility of the doctor, not only the responsibility of the doctor, not only the responsibility of the policy makers, it is an individual responsibility. You also need to think about the future of our kids, future of our generations. If we go like this, in about 30 to 40 years time, there will be people dying of communicable diseases due to bacteria because they don't get antibiotics. They don't have effective antibiotics. All are now, all the antibiotics, the bacteria have developed resistant mechanisms to cope up with all the antibiotics. So it is very important to understand this concept. This is actually people tend to think about that moment only to cover or cure the infection they are having now, but not thinking about the future. So it's very important to limit and get the regulations done to minimize the over-the-counter issuing of antibiotics without a doctor's prescription. It is there now. They say not to issue, but still if it is happening, we need to take proper measures to prevent it from being done. Because if you give something like co-amoxiclav, now co-amoxiclav is an antibiotic which is abused. Co-amoxiclav is given even for the simple viral infection, viral chest infection. I have seen such prescriptions. So it is very important to prevent that. That is a broad spectrum antibiotic. Co-amoxiclav is reserved for certain resistant group of organisms. If you give this resistant, the antibiotic which will fight against resistant organisms to a simple viral infection, then once the organisms develop resistance for that, you don't have anything else to give. So it's very important to identify that this is a issue that we need to discuss and make the people aware, not to abuse and not to take. Now, the other problem that I have seen is you are being prescribed for antibiotic for a urine infection or kidney infection for 14 days. You take it for 3 or 4 days and then you feel very well and then you stop. You think that I feel very well because the organism is killed, I don't have to take it. So that is the point. The organism develops resistance. It is not killed yet. It is a subtherapeutic dose. Now he received the antibiotic in little amount. Now he plans his way. He is now making ways of fighting against this antibiotic. So it is you who has created this problem. Now next time when you get the infection, the antibiotic will not work because now the organism is resistant. That's why that we tell you repeatedly, if you are prescribed an antibiotic for 14 days, take it for the full period, even if you feel very much better. You will feel better by 4th day, but you need to continue until 14 days. Adhere to your prescription. That is important.
In fact, doctor, that was a question I wanted to bring up. I'm glad you answered it anyway. You explained the situation because we have come across complaints from your side doctors who lament, sit here in front of me and say, we tell them to take their entire course of medication. They don't. They stop halfway because they're feeling good. And then they come back. And there are those who don't even come for a second time to the clinic when they have to because they feel good.
Yes.
And
they stop it
not
once
finish the medicine. Half of it is still there and they're feeling good. You're due to come next month. You don't come next month.
I have seen that as well.
So this is very, I think, very much part of, I think, our kind of culture where you sit back, you take things so easy. And you think, I'm good now and I don't have to bother anymore. Which is really, I think...
this type of programs, I think, is very beneficial to educate the people on such situations.
This message has gone across, I must say, several times because in so many aspects of health, and obviously there is medicine involved, some medication involved, I mean medicine and medication, and then the medication is not taken as it should be taken. And primarily, you feel good after a week, you have another week going, you don't bother because you're good.
Now, when you take antibiotics, the other medications, blood pressure medications and diabetic medications and all that, if you stop the medication when you feel your blood pressure is okay, when you feel your blood sugar is okay, if you stop that medication, you are doing harm to yourself only. But here, antibiotics, if you take it suboptimally and if you don't take the entire course, you are not only harming yourself but the entire population because you are giving chance for the bacteria to develop resistance, and that resistant bacteria will be a threat to entire community. So antibiotic prescriptions, not adhering to the prescription, is harming not only yourself but to the general population.
Thank you so much, Doctor, for highlighting all these vital points that our general public need to know, and they need to also follow to the letter, I would say, the do's and the don'ts. So, Dr. Time is catching up with us. What is your take-home message?
Yeah, my take-home message is antibiotic resistance is a big problem. It's actually a very big problem, and we are going to go for a period which is like pre-antibiotic era in not less than 50 years time. So please take this as a serious issue and take your medications as prescribed by your doctor, and don't get over-the-counter medication, over-the-counter antibiotics, and very importantly, don't treat every viral infection with antibiotics.
Thank you, Doctor. There we end this interesting discussion on antibiotic resistance. And our grateful thanks go to Dr. Nilangika Sandakumari, consultant physician, University of Sri Jayawardhanapura, for being with us in the midst of your busy schedule on the program Views on Health, and sharing your expert knowledge with our listeners. Thank you so much, Doctor.
Thank you very much for giving the opportunity to.
Thank you also to Nadira Manamperi for technical assistance. I'm Fatima Razik Haider saying good night, and hoping to catch you next Monday, same time, on Views on Health.